Warm welcome, you're watching To The Point. Now, through the course of the bulletin, we're going to focus on what each state is doing in India to combat coronavirus. However, I want to take you right now to Italy, which has now become the epicenter after China, as Italy enters its fourth day of a nationwide coronavirus lockdown. The entire country saw empty tourist sites with bars, pubs, restaurants all shut, but that's just what you see in the front. The death toll from the outbreak of the coronavirus in Italy has jumped by 189 to 1,116, a rise of 23%. We do not want to sound alarmist, and we want to give out the information as it is. And one must bear in mind, this is what is happening in Italy, not in India. I spoke to Italian journalist Francesca Borri from Lombardy. Now, she is in the reddest zone of COVID-19 where Italy is concerned. Listen in to what she had to say. And once again, we want to reiterate, Francesca reports from the reddest zone of the coronavirus, not just in Italy, in possibly the world right now. Can you give us a sense, Francesca, on what are you witnessing in Lombardy? We do know it is the reddest zone where the coronavirus in Italy is concerned. Very few reports coming out because there are very few reports which are being done right now. What are you seeing?
I'm in a little town called Alzano, Lombardo, and this is really the epicenter of the crisis, because this is where the first Italian infected was found. And basically what happened, but of course it didn't happen only here, unfortunately, a major doctor of the local hospital got infected quite early. And so, unintentionally, that's how the virus spread. And this is, of course, a dynamic that we will see, everywhere, or nearly everywhere. So here, somehow, we are 1 hour away from Milan. In northern Italy, Milan is the economic capital of Italy, but it's like, somehow we are 2 weeks ahead of the rest of Italy, of Europe, and I think also of you too. And, in 2 weeks, basically, it's a matter of intensive care. So we already ran out of intensive care beds here. And so everybody's infected, so no one is counting the infected anymore. I mean, no one is testing anyone anymore. Officially, here there are 35 cases, and yesterday we had 16 dead. So, of course, the number of the dead is higher than the number of cases. So no one is looking at numbers anymore because they make no sense now. Because once, the intensive care beds are over, basically people are asked to stay at home and to get syrup and, normal drugs for flu until they can breathe somehow. Then at some point, for most of them, in a few days or in a week or two, it's all fine. But for a significant number of them, and even quite young patients, at some point they are in need of oxygen. And the point is, so first you run out of intensive care beds. And so you have, the elderly, the fragile subjects, all dying. Then you run out of oxygen too. And at that point you see that, even younger patients start to die for nothing. I mean, you see during the night there are ambulances all day and all night here, but during the night it's terrible because, when I wrote my first reportage, it was published on Tuesday, so written on Monday. Now we are on Friday, and last night, I could hear ambulances all the time, But now I can hear also, people screaming because you have someone, at home that suddenly stop breathing. And some of them die in this way because they don't have any oxygen tank. 2 nights ago, I was with a local pharmacist, and 42 relatives came asking for an oxygen tank, and there was not even one left. And then there is another step. So first, the elderly and, let's say, the sick, those who already have another pathology. At the beginning, according to our estimates, 80% of victims had another pathology. Then the second step, and basically the virus that simply, because of a respiratory crisis, die quite suddenly. And then there is the third step, which is where we are now. The real reason why we have to stay at home, like all other Italians, now in Italy, if you get out, you need to prove to the police, because there are checkpoints everywhere, you need to prove with a written motivation, with a written statement, you have somehow to self-certify that you have urgent needs to go out. And, in case, you are lying, you risk up to 3 months in jail. And the point is now, this, new rule, in the other parts of Italy is because in this way the government hopes to stop the infection, the spread of the virus. So everybody's already infected, so the reason why we have all to stay at home is because if you get out and, I don't know, you just have a car accident or a heart attack or anything, it's raining and you sleep sleep down in the street, there are no doctors, there are no medicines, all resources are, for the coronavirus patients. So everything else, now you can die of anything because there are no resources anymore, and basically the health system, has already collapsed.
So once again, we want to reiterate this, viewers, is in Lombardy. It's in Italy. It's the reddest zone where coronavirus is concerned. Italy's become the epicenter, and possibly this would be the reddest zone in the world. Francesca is one of the very few, and I believe there are not more than 4 or 5 reporters who are actually reporting actively out of that region. What she says sounds bleak, but it has no correlation to what is happening right now back home in your country, India. And hopefully, we will be in a position where we will be able to battle with COVID-19 way much better than Italy. And I want to take our viewers through what possibly each state is actually doing right now. A lot of measures, viewers, have been put in place right now with many states. They have made sure, for a reason, that they will do what they can to make sure that it does not spread. Let's take a look in the case where Delhi is concerned. Well, Delhi has already declared the coronavirus as an epidemic. It's done so. 6 positive cases have till now, active cases have been reported from Delhi. Schools, colleges, cinema halls have all been shut till March 31st. No IPL matches. We know that the IPL matches have got postponed, so no other major sports event will take place in Delhi. In fact, the Delhi Chief Minister has clearly urged everyone to stay away from any public gathering, no seminars, conferences or any big event. Well, public transport offices are being disinfected, especially where government offices are concerned. Private offices have also been told to follow the same protocol. Let's cut across right now to Kerala. Kerala till now has reported 22 positive cases of coronavirus, declared an epidemic. All schools, colleges now have been shut up to class 8 till March 31st. More so, public functions postponed, cinema halls shut, and all other tourist attractions have been shut in the state of Kerala. Let's take a look at Haryana. Well, NCR region, 14 positive cases have been reported from Haryana right now. A lot of that 14 is Italians, tourists who are admitted in a hospital in Haryana. Over 270 isolation wards with 1,206 beds have already been set up in the small satellite town of Manesar. Schools, colleges remain shut, viewers, in Haryana. Maharashtra. There was a press conference addressed by the Chief Minister Uddhav Thackeray a short while back. 17 positive cases right now in Maharashtra. Coronavirus has been declared an epidemic in the state as well. Primary schools have been shut. Private schools have been shut unilaterally. They've taken a decision on their own to keep shut. Gymnasiums, movie theaters, public pools, all have been shut down. companies have been urged to allow their staff to work from home. Moreover, information sought on travelers from various embassies, depending on if they've come in from any country which has a high infection rate where coronavirus is concerned. Let's take you right now to Karnataka. 7 positive cases have been reported from Karnataka. Coronavirus has been declared an epidemic. Once again, schools, colleges shut in Karnataka till March 31st. Restaurants, malls shut. Now, this is going to be in play from tomorrow from Karnataka. Word coming in that even sit-down restaurants have been told to down shutters. Only home delivery is being allowed. And of course, a campaign is starting where Namaste now will take the place of a possible handshake. Let's move on. Jammu and Kashmir, Ladakh, well, all three have reported 5 positive cases. Once again, it is an epidemic in all Jammu, Kashmir and Ladakh, the Union Territories. Now, primary schools, cinema halls have been shut till March 31st. Let's take a look at Uttar Pradesh. 11 positive cases reported till now. Schools, colleges shut till March 22nd. We're going to keep updating the list. If you do find, your state in there, these are the major, moves that these states have made, but not just these. Even, we're talking about Chhattisgarh, we're talking about Bihar, we're talking about even as far, we're talking about Telangana, Andhra Pradesh. So schools have been shut there as well. We're going to keep giving our viewers the very latest, but I want to cut across right now to our guests. I have Dr. Rajesh Parak, Director, Jaslok Hospital. He's joining us, and we're also going to be joined by a doctor, in this case from the state of Kerala, Dr. Padmavati. She's a senior pulmonologist, and she joins us from Kerala. Dr. Padmavati, I'd like to begin with you. Right at the top of this broadcast, Doctor, we had a journalist from Italy. Now, the picture that she painted was extremely bleak. Some of our viewers might have got alarmed. We want to put out all the information, but I also want to ask you, Dr. Padmavati, we are nowhere near what's happening in Italy, but are we anywhere close? Are we going to look at a sudden spike? Are we look at, from this slow growth to this exponential growth?
Okay, so what we are seeing right now in India is actually a slow growth, because we have actually woken up and sort of realized, although we've had a lag period of nearly 2 months to think about it, and definitely Kerala is leading the forefront in that aspect, in that we have hiked up the detection rates, all the government set up. Our health minister is doing such a wonderful job in the fact that, she has brought out a proper guideline which is publicly available in the website, and according to that we are actually following the precautions and categorization of patients into ABC, and then all hospitals and doctors alike can actually deal with these patients in a uniform manner. So actually what we need to do is all the states in India need to wake up and sort of follow Kerala's example and go forth. But what is very, very clear from the Italian and the Chinese example is that whichever countries manage to, sort of completely and as much as possible practice social distancing and kind of cut the transmission rates, that's what's going to help. And whichever countries, whichever states are not able to do that actively will definitely see an exponential rise. Now on a forefront, what we expect right now is possibly there will be a slight rise in cases because we have stepped up the detection rates, and people are actually willingly coming forward to get tested, and they're reporting to the public health authorities. I know that we had a couple of cases where people played truant, and we sort of had a big loophole there where a couple of a lot of people got infected, but people are realizing that they have to come forward and get themselves tested. People are realizing that they have to practice social distancing. And now Kerala, having declared an epidemic and having put almost the entire state, the schools are closed, and like you mentioned earlier, all the public gatherings are not happening, conferences have been cancelled, cinema halls have closed up, even ecotourism and all tourism spots are closed up, which I really think is the best way to move forward. And what else we're doing is that of course whenever a person picks up the phone and makes a call, I know you're aware that you get the message. So that's the way forward. Actually, social distancing has to be done on a uniform basis throughout India.
Okay, all right. Dr. Rajesh Parak,
Yes.
I want to also bring you in on this and maybe talk directly to our viewers, because I spoke to, like I said, and you were, I'm sure you heard it. We spoke to Francesca. She's a journalist in the reddest zone in Italy, and possibly it's not just in Italy, it's the reddest zone right now in the world where coronavirus is concerned. Therefore, I ask you, Dr. Rajesh Parekh, how different are we right now from Italy, and what is it that we can do? Are we going to see, is there an incubation period that we have to watch very closely where India is concerned? Is it like a week, 10 days, 2 weeks? What are we looking at?
Yeah, hi Preeti. That's a very appropriate question. And I'm happy you talked to Francesca and Dr. Padmavati prior to me. So I'm just going to add on to what they had to say. First of all, Kerala has always been ahead of its times. They've led the country in literacy rates, in population dynamics. So what they're doing is the right thing. Your specific question, where do we stand with respect to Italy, depends on whether you mean cross-sectionally or across time. Cross-sectionally, we are where Italy was some time ago, maybe 2 or 3 weeks ago. If you look at it longitudinally, we are following the same curve. There are few patients seen. Now there are going to be more coming. Where I have a slight difference of opinion from Dr. Padmavati is I don't think it's going to be a slight increase. It's going to be a substantial increase if the mathematical models that have been created by statisticians and experts hold true in our country as they have in China, Italy, South Korea, to a smaller extent in the US, then we can expect more than a slight increase. We have to learn best, not just from Italy, but from China. And there is incredible news. Whatever they did, they failed on several counts. But what they've done is it's been so effective that earlier you would get 100 cases a day. Today they're all in single digits. Chinese researchers are finding it difficult to find patients, new patients, to participate in research studies. So the things Dr. Padmavati talked about have worked effectively in China, and where we are with respect to Italy is where China was around our time, where Italy was around our time. If we can learn not just from what Italy is doing, but what China has done and what South Korea is doing, they're doing some incredible things. If we learn from these countries, there is a lot we have to learn.
Dr. Rajesh, and I'll go back to you, Dr. Padmavati, as well. But I want to ask the both of you one question before I cut across to my colleague Nabila. And the question I want to ask you is there an incubation period? Are we looking at now the test case or the test time for India is 2 weeks, 3 weeks? Are we looking at that maybe we'll peak and then we'll start waning, or it can go anywhere because nobody quite knows what this virus is? Dr. Parekh, go first.
Yeah, okay. So it depends on what precisely you mean by incubation period. If you're talking of incubation period in the individual, and I assume you're alluding to the time from when an individual gets the infection, from when he harbors the virus, from when it enters his body, to the point that symptoms are prominent, that can vary. It can go up to 12 and a half days, during which time the individual may be asymptomatic, but during that time, he or she can transmit the virus, particularly more so in the 2 to 3 days prior to those 12.5 days. And 12.5, of course, is a numeric, it's an average. So 12 to 13 days. And that's the worrisome part. Because here is a person who doesn't
quite know he's a carrier.
Doesn't feel any compelling need to do social distancing, washing hands.
Okay, so Dr. Padmavati, the question I want to ask you is, so Dr. Rajesh Parekh gave us a micro picture of an individual. I want to ask you about the country. Are the next 2 weeks crucial, or it can go anywhere because we don't know the virus at all? For India, what are we looking at a time frame where we are expecting it to peak and then possibly wane?
Absolutely. So what I mentioned earlier about it peaking slowly is if and only if we manage to effectively replicate Kerala's health policy right now in terms of COVID-19 on a nationwide basis. So I know that March 15th onwards, a lot of visas are being cancelled, and India literally is probably going to go into a kind of a self-isolation, like a countrywide self-isolation. I think this is like a great period when this kind of, health directive can be replicated for the rest of the states in India, and if we have 2 days still to do it, if we can do that nationwide, definitely there's going to be a peak. There's no doubt about it, because we're detecting more, and definitely the number of cases, like you said, something 22 around Kerala, definitely there are a lot more cases out there which are not detected, which are there in the community. These are only the ones that we have detected, and there is a limit to the number of ones we can detect. So definitely there is a lot more of transmission going on in the country, and I am aware that a lot of neighboring states, though they have woken up, they still haven't gone into the strictest mode possible. By that I don't mean like a complete, widespread panic and scare that, shops close up, petrol pumps close, or I don't mean anything like that. What I mean is, wherever there are public gatherings, people, sort of completely socially distance themselves, and also, containment efforts are done, then definitely this peak will come down sooner than we can expect. And as a country, all hope is not lost. All hope is not lost. What is important is that, good things like what you're doing right now, social media, the governmental authorities, and all these people, leaders in the field, can actually, completely educate each and every person, and every person takes it upon themselves to come forward and get tested, and then do self-isolation, apart from, of course, the hand hygiene and the cough etiquette.
All right, okay, stay with me. I want to cut across right now, because I'll take off from what Dr. Padmavati said. It's about, if you feel any symptoms at all, what should you do? A lot of doctors would say, till the time possibly you feel a little problem in breathing, you should just stay at home. But having said that, what is the protocol for testing in India? A lot of you out there don't quite know it. Do not rush to a private hospital. That's number one. It's over to my colleague Nabila to take you through on what to do. What is the protocol for testing for coronavirus in India?
The coronavirus crisis has led to panic among people who find the urge to go get themselves tested. Several private hospitals have been saying that people are coming in with or without symptoms to check themselves. Well, private doctors will indeed check you, but they will not check your blood samples. They will not test you for coronavirus. So to save time, energy, and for the larger good, it is recommended, if you do have severe symptoms, then only go to designated centers. Do not go to any private hospitals in the city and waste your time. And this is only going to create further panic. Approach only designated labs and hospitals. It's mandatory. Like, for example, Delhi itself has 2 designated centers. NCDC, the National Center for Disease Control, as well as AIIMS, All India Institute of Medical Sciences, are the only 2 centers where you can get your blood samples tested for coronavirus. Just like that, similarly, every state has a designated center. Every city has a designated center. And to find out more on that, of course, you can log on to the Health Ministry's website. If not, you can also log on to indiatoday.in to get further information. But do remember, if you do have to get to these centers, you have to have symptoms, severe symptoms. If not, stay home and stay safe.
All right. Thank you, Nabila, for joining us. And thank you, Dr. Padmavati, and thank you, Dr. Rajesh. It's a pleasure that we had you, and thank you for, talking directly to our viewers. We leave it at that. We're going to continue to get you the latest development in India and outside on coronavirus. Stay with us. Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.